Today, we opened eligibility to all seniors who are 75 and older. And as of, just moments ago, when I last was briefed on this, we had over 25,000 appointments that had been booked so far today. And the first shots booked this morning are getting done this afternoon. As the next step, I'm thrilled to announce today that COVID-19 vaccines for Albertans 75 and older will begin to be offered at community pharmacies in the first week of March. Participating pharmacies will begin scheduling appointments today for the time slots that they have available, and this will make it easier for seniors to get their dose as quickly as possible. This is a step that just makes sense. As anyone who has gotten a flu shot knows, pharmacists have a lot of experience in delivering vaccines. They have played an important role in our seasonal flu program for many, many years, and they have the skills, they have the experience, and they have the infrastructure in place to be an important part of our immunization program. Now, those who are 75 and older will be able to book their immunization appointment at more than 100 participating community pharmacies in Edmonton, Red Deer, and Calgary. And the Ministry of Health has been working with the what we call it the RXA, the Alberta Pharmacists Association, to develop a program for pharmacies to provide vaccine across the province. Now, to start off with, due to limited supply and logistics required, the vaccine will be limited to participating pharmacies, as I said, in Edmonton and Red Deer and Calgary. And we know that many pharmacies across the province are keen to jump in and assist in this immunization program. However, we must start small due to the limited vaccine qualities that were being provided by the federal government and the strict storage and handling requirements for the Pfizer vaccine. The ministry has selected the first pharmacies based on geography, as well as on population needs, as well as their demonstrated ability to handle large volumes of immunizations in short time frames. Considerations for things like physical distancing and infection prevention and control processes are also critical. And in this first stage, we anticipate there will be a total of 102 pharmacy partners in Edmonton and Calgary, and as I said, Red Deer, to help immunize the large number of folks who are 75 and over. And I want to reassure those eligible Albertans not in or near one of these centers that they will still be able to receive their doses of the same time frame, close to home through AHS. And as we announced last week, Albertans born in 1946 or earlier can book a vaccine through Alberta Health Services online booking system or through the telephone. And those booking systems open today. What we're announcing today is even more access to vaccination through select community pharmacies. And this is just the start. As soon as we have the supply and the processes in place, we plan to expand the pharmacy program to help us get doses in the arms of every Albertan who wants to get vaccinated when they are eligible. And as more vaccine arrives, participating pharmacies and many other communities will begin to offer the vaccine as well. We are ready and we are able to keep expanding our approach. And with the support of the Alberta Medical Association, the AMA, we're working on plans to expand the rollout to community physicians as well. And we're also working on plans to develop large, fast flow immunization clinics, as I've referred to them in the past, rapid flow through clinics that can be stood up at later stages. The only limit that we have is the number of vaccines available to us. And as that number expands, our approach will keep pace. Now, before I close, I want to say a word about the start of the rollout this morning. And I know a lot of folks were frustrated that they couldn't get through to book an appointment right away, and I sympathize with them. At launch this morning, more than 150,000 people tried to visit the booking site, and temporarily the AHS website was overwhelmed. And there were also long delays on the health link booking appointments through the phone. And I get how frustrating that must have been. Look, one of my parents and both of my in-laws are in the age group that were able to book appointments this morning. I understand their frustration, the frustration of all of these Albertans, because this has hit home close for me as well. And so, look, it's been 10 long months in this pandemic. People's nerves are worn raw by nearly a year of restrictions, a year of uncertainty, frustration, stress, and anxiety. And about when we will be free of these restrictions and this anxiety. And vaccines are our ticket out of the pandemic, out of this anxiety, out of this stress. And so any delay in booking an appointment is yet another difficulty and another frustration for folks. So I'm disappointed, but the fact is that it's going to take time to reach everyone. We are getting a bit over 5,000 or 50,000 doses per week, and we have 230,000 seniors to cover at 2 doses apiece. It's going to take about a month to get first doses to all of these seniors. So to everybody who was disappointed this morning, I want to say that I'm with you. AHS is fixing the problems with the booking system as fast as they can, and they'll catch up quickly. The system can now handle about 5,000 bookings per hour. AHS has added network capacity. They've added staff to HealthLink. They are working directly with TELUS to make sure that any intermittent busy signal some TELUS subscribers were dealing with this morning is no longer a problem. And these shots are going to take a few weeks. We won't get to everybody right on the very first day, but we will get to all of you. And so I want to emphasize the shots are happening. The delays in getting through to the booking system will not slow down the actual vaccinations. They are going ahead as planned. And as I said, last time I spoke to AHS, 25,000 eligible seniors had successfully booked appointments. And the first shots booked this morning, as I said, are getting done this afternoon.